This skill demonstrates obtaining a history from an alert and oriented patient. The first step in this skill is to obtain the patient's demographic data. When I approach the patient, I can observe she is a Caucasian female. I'll introduce myself. Hello, ma'am, my name is Nathan. I'm a paramedic. Can you tell me your name?
Katrina.
And Katrina, how old are you?
I'm 24.
And about how much do you weigh?
About 125 pounds.
Who called EMS today?
I did.
We've now determined that the patient is fully alert and oriented and has the appropriate decision-making capacity to consent for treatment. We'll now continue with our assessment. Next, I'm going to determine the patient's chief complaint. Katrina, can you tell me why you called EMS today?
My stomach is really hurting.
And how long has this been going on?
Since last night.
And when did this start?
Last night after dinner.
And was the onset gradual or sudden?
It was pretty sudden, but it's gradually increased.
Does anything make it better or worse?
No, not really.
Can you point to exactly where your pain is located?
Right here.
And does it radiate anywhere?
Everywhere pretty much hurts, but the severe pain is like right here.
And on a scale of 0 to 10, how would you rate your pain right now?
It hurts really bad. I'd say like an 8.
Next, I'm going to observe the environment to see if there is anything particular about this setting. After observing the setting for any unique findings, I'm going to ask the patient about any treatments. Katrina, have you taken anything for this problem?
Well, I've been feeling really nauseous, but I haven't thrown up, so I've been drinking some ginger ale and eating crackers.
So I've identified the pertinent negative that the patient has not been vomiting. I'm now going to move on to my focused assessment. I'm now going to determine the patient's past medical history. Katrina, how would you rate your overall health?
I'm overall pretty healthy.
Do you take any prescribed medications?
I take birth control.
Do you take any over-the-counter medications?
Just daily vitamins.
When was the last time you took your medications?
This morning, I take it every morning.
Have you ever had any problems like this before?
No.
So I've determined that this is an acute illness. Do you have any allergies to medications or food?
I'm allergic to penicillin.
Have you had any surgeries in the past?
I've had my tonsils removed.
Do you consume alcohol?
Yes, occasionally.
Do you smoke?
No.
Do you use any other tobacco products?
No.
Do you use any street drugs?
No.
At this point, I would continue to question the patient, if appropriate, on pertinent family medical history or psychological history-related questions based on the patient's presentation. After I've obtained a thorough history from my patient, I'm going to organize a verbal report. So I have a 24-year-old female with a gradual onset of acute right lower quadrant abdominal pain, progressively worsening over the last 8 hours. The patient is complaining of nausea but denies any vomiting. The patient has no significant past medical history, is allergic to penicillin, and takes birth control daily. I'll now move on to a physical assessment of my patient.